In our last video, we talked about how social media algorithms are gaslighting an entire generation into pathologizing normal human development in some cases. We exposed how ordinary emotional intensity, relationship anxiety, and the identity shifts of your late teens and early 20s might be getting mislabeled as borderline personality disorder. But that leaves us with a critical high-stakes question. How do you actually know the difference? So where's the line between typical, highly intense emotional variability, what some people call normal, and a true clinical diagnosis of BPD? As a licensed psychologist with over 2 decades of experience diagnosing and treating personality disorders, I'm going to give you the framework, the exact framework we use in a clinical setting so you can stop guessing and start better understanding your psychological software. So when a patient comes to my private practice, I'm never looking at an isolated emotional reaction. I don't look at a single bad fight, a dramatic breakup, or a temporary season of intense stress. Instead, we evaluate a psychological pattern using 3 distinct non-negotiable pillars: pervasiveness, duration, and functional impairment. Let's unpack that. So pervasiveness. Normal emotional volatility is almost highly context dependent. You get triggered because you're exhausted. Your relationship is in a rocky transition, or you're navigating a massive life shift like a high-stress semester or a hormonal change. But true borderline personality disorder is rigid and pervasive. It means the emotional instability, the intense fear of abandonment, and the extreme identity shifts occur across all domains of life. It shows up with your partner, but it also shows up with maybe your coworkers, your classmates, casual acquaintances sometimes, and family members. It's an inflexible operating system that generally doesn't change regardless of the environment. That's without treatment. It obviously can change. You can reprogram things. The second pillar is duration. So normal emotional waves come and go. That's just part of life. You might have a chaotic, highly reactive month after an emotional betrayal, but your nervous system eventually regulates back to a stable baseline. In BPD, this pattern is enduring, chronic, and stable over years, typically tracking all the way back to early adulthood. And the third pillar is functional impairment. Functional impairment means the behavioral output is actively destroying your life infrastructure. It may mean you can't maintain stable employment because of sudden outbursts of rage. It may mean your relationships don't just have typical friction, they're trapped in a constant destructive cycle of extreme idealization and complete devaluation, also known as splitting. Think about the iceberg theory of anger that you've heard me talk about. So anger is a superficial emotion. It's only the top 10% that we see. Below the surface of the water lies the other 90% of the iceberg. Intense shame, deep-seated terror of abandonment, maybe profound emotional pain. Someone experiencing normal volatility might feel that 90%, but they can pause, reflect, and choose a non-defensive response instead of reacting. Someone meeting the criteria for BPD experiences a system that is chronically hijacked by the amygdala that they most often can't access the prefrontal cortex to downregulate. Their behavioral output is consistently reactive, defensive, and highly disruptive to their safety. Again, it can be helped. So if your emotional shifts are episodic, context dependent, and you can still maintain your career, your friendships, your baseline sense of who you are, etc., you may not have a structural personality defect. Your system is simply giving you feedback that you're carrying too many physical, emotional, or psychological vulnerabilities. You don't need a heavy clinical diagnosis. You just need better tools to mitigate those vulnerabilities. But if you look at those 3 pillars, pervasiveness, duration, and functional impairment, and you realize your system is genuinely struggling to stay safe, don't look for answers only on an app. An app can direct you, into the right place. That is definitely a thing. But reach out to a qualified licensed clinician who can provide a comprehensive differential assessment and a real pathway to healing. Now, if you can't afford to do that or don't have access, at least pull up the diagnostic criteria from the actual DSM-5 and see how it really breaks down. Then if you really think it fits, there are all sorts of resources available for you so you can start tackling your symptoms. A lot of those resources are either free or low cost if you search. Whatever you do, don't give up. Help is available, and as we've discussed, BPD is highly treatable.